Hello, I'm Dr. Rachel Orscheln, a Washington University pediatric infectious disease specialist at St. Louis Children's Hospital on behalf of the Pandemic Task Force. During the pandemic, in addition to my work caring for patients in the hospital, I've been engaged with groups working to return students to safe in person learning. I've had the opportunity to collaborate with state agencies, local health departments, my pediatric and infectious disease colleagues, as well as both public and private school leaders through an organization called Education Plus. Our primary goal has been to advocate for the safe return to school for our students. I sincerely hoped we'd be in a different position at the beginning of this school year with regard to community transmission of the novel coronavirus. As a parent of school age children, I am looking forward to a time when school operations return to normal. Unfortunately, that time is not now. Fortunately, there is some good news for the start of this school year. We have learned over the last year through multiple studies what strategies are necessary to keep children safe in schools and to avoid interruptions in in-person learning. These are relatively simple strategies that include screening both kids and adults for illness and keeping them home when sick, utilizing face coverings, particularly in the indoor environment, using physical distancing of 3 to 6 feet, and encouraging good hand hygiene, among other strategies. This year, we also have the benefit of several very safe and effective vaccines, which provide an additional layer of protection for both students and teachers. However, at this time, many students are not eligible for the vaccine. In addition, many people who are eligible for the vaccination have not yet received their shot. For this reason, we continue to see a large number of people in our community that are susceptible to infection. We have learned that in situations where children congregate, if mitigation strategies are not used, outbreaks of infection can occur. Fortunately, most children will have a mild course of infection. However, there are some that will have a more serious infection, and it's possible that as many as 5% of children will have persistent symptoms. Also, children who are infected can spread that infection to other individuals, such as family members who may be at higher risk of complications due to their age or underlying medical conditions. Using mitigation strategies not only protect children from illness, they also protect children from learning loss by reducing the chances a child will need to quarantine when an exposure occurs in the school environment. Last year, many children lost out on days to months of in person education. This year, we know what is necessary to keep kids in school. Vaccination is the best approach to prevent illness, but other simple strategies, such as the use of face coverings, can ensure children avoid both illness and the need to quarantine. So let's do what's right for kids and follow public health advice to make sure all our children have a wonderful and safe start to this school year. Thank you.